the upper thoracic region, there's a muscle that we often tend to forget about, and that is serratus posterior superior. The fiber direction mimics the rhomboid orientation, so it starts at the spinous processes, but instead of going towards the scapula, it will actually follow the ribs and attach to the rib angles. So our technique will include stripping with fibers and then trying to separate the layers. It is deep to both the middle trapezius and the rhomboid, but it is more superficial than the erector spinae, so it's nice to have that layer approach to this area. Again, starting at the spinous processes, scooping into that lamina groove, and then trying to slowly strip, thinking about going through the rhomboid, this time paying more attention to the ribs underneath, and then I'm zigzagging, trying to get that muscle to move relative to the rib, and then keep your contact with the rib. So don't let this, as you getting close to the scapula, don't aim your fingers towards the scapula, keep the contact with the ribs. So there's a few options here. If the scapula is moved away from the midline, it might create a little bit more space for our fingers to follow the serratus muscle, but at the same time it will create tightness in the superficial layers of middle trapezius and rhomboid. So it might prevent us from being able to penetrate them. So try different approaches, either with hand close to the client's body, with the scapula close and trying to sneak underneath the scapula, or by bringing the elbow slightly higher and see if that allows you to have more room. So it depends on the size of the client and the thickness of the layers. One or the other approach might work best. Remember, the idea is that the fingers follow the curvature of the ribs rather than going straight towards the edge of the scapula. And then cover the entire surface of the muscle, starting at C7 spinous process. Here we go through the thicker part of the upper trapezius, so it's a little bit harder to feel. And the first attachment would be on the second rib, so you don't have to go quite as high. Keep your angle roughly at 45 degrees from midline.